regret, respiratory grief upon death of a patient, feeling of guilt not to prevent the illness or protect the patient. There'll be that feeling that will come out for cancer patients, especially after they've lost their loved one. The things that will come out, one of them being the emotional aspects. Of course, is the grief. And when the patient is not really dead, there's grief that will be withheld, that sometimes that will grief. Financial strain because chemotherapy is expensive. Cancer management is expensive. And of course, there will be stigma from the society that this person died because of this and this and this and that, which is not true. And of course, survivor guilt. Um, that is when the patient is sick and might die. And of course, mutual protection resulting in communication issues. They concentrated so much on one family member, but they did not concentrate on another. So we need to support them by holding meetings, express their feelings, ask questions, raise their concerns, provide a reassurance based on their interest at heart, probing and answering questions with helping to them to understand where to as far as cancer management is concerned, and of course coping techniques, assisted assist them through the past, what to help them identify coping their techniques and remember how to assist each other. And of course effective communication. Communication acts both ways, and and find their way to solve their own solutions and facilitate their discussion and support their decisions. And of course, continue. There's the role of acting as a mediator in the family and finding ways forward to solve their issues. And of course, starting a discussion. It's important to work by the side, providing support. Um, Families will ask questions rather than listen first, later, which is okay. Important to prefer to them, I'm not sure, and or what do you think, what will happen moving forward. And of course, relating with the child, in the family, there's the individualization, recognition of each patient and the family is unique, so therefore needed to treat such and not just being a typical family member or of a category or group. And of course, there's a purpose for extension of feelings and of course, refusal to deal with a total person. This is the recognition of the patient and family members who need to express their feelings. The responsibility is to listen purposefully without personal biasness to deny patient and family need to express their feelings and refusal to deal with the person. As I end, there is the non-judgmental attitude. You don't have to judge them based on their belief. Social work includes does not include assigning guilt or innocence, like the self-discrimination, um, giving them freedom to express their own choices, and of course confidentiality. Um, Not unless their life is in danger or anything else. Confidentiality is also important. Sensation and information disclosed that needs to be shared to a treating, well, be shared with the treating team or legally obligated to disclose. You can inform the patient or family before doing so. It's important to understand that there are limits. There are instances you have to share information. So that brings me to the end of palliative care. And all I can say is thank you.